Hello, my name is Ayaan Parikh, and I'm a state representative on the HOSA state officer team. I'm here with Mr. Lacy. Thank you so much for taking the time to meet with us today. Today we're going to be talking about rural health, how that kind of is different from urban healthcare, and where there's opportunity for growth and the strengths of rural healthcare. So before we begin, I'd just love to hear your thoughts about your experience with rural healthcare in particular. Over your career, how much have you worked in rural healthcare, and just what's your overall experience with that sector of health?
I would say that I've worked in rural health exclusively from a large rural health perspective, and by that I mean a community of 40 or 50,000 on down to very small and remote rural health, and by that I mean a community of down around 1,500. And so quite a broad gamut.
Yeah.
I think the challenges of rural health center around the low population density, and that low population density means it's harder to attract a workforce. It means it's harder to get the resources we need to have the advanced technologies that we need sometimes. So we may be operating with good technology, but it may not be the newest, latest, biggest, fanciest, or anything else. We strive to make sure that we're able to provide the standard of care. And the standard of care is different in a rural setting than it might be in a university setting. Because in a university setting, you would have everything, you would have all the specialists and everything. In a rural setting, you might have a family practice physician that is practicing with a couple of PAs, and you have a cadre of nurses who have a variety of talents and experiences. And so as we care for the patient, we want to provide the best care that we can given the resources that we have available. And I think that at the center of it is what our challenge is. At the same time, I think some people say, oh, it's rural healthcare. Oh, too bad, so sorry for you. I think it's very good healthcare. It's very caring healthcare, and when we need to transport somebody, we do. It's not about money, it's about taking care of the patient first. And so the other thing I would say is, as you look at the hospital boards that are being stewards over those hospitals, I think that's an important role in healthcare. I think the county commissioners that make dollars and funds available to those hospital boards to help operate that hospital are also important. I've said this in front of many county commissioners and many board members. When a community doesn't have local critical mass of population to support those services, somebody else is going to wind up paying for it. Mm-hmm. And so that's often the case in the small critical access hospital.
Yeah.
As a matter of fact, the critical access program was developed so that those small, rural, frontier almost hospitals can survive and provide access to care.
Yeah.
And access to better care than they might otherwise be able to provide. Mm-hmm. And so our job is to operate that hospital as it should be operated, keeping in mind the patient will come. The other thing I would say is that we go loaded for bear a lot of times in an environment that has a lot of squirrels.
Yeah. Yeah.
We don't know what's going to walk through the door, and
yeah.
so we try and be ready for the worst case. And a lot of times it isn't. But when the bear is after you, you'll be glad that we're loaded for bear.
Yeah, 100%. So you talk about how oftentimes many individuals who give specialty care in the healthcare sector, they oftentimes don't go to rural areas because of the low density population. Do you think that's going to kind of stay an issue, that's going to kind of continue in the future, or what steps do you think can be taken to incentivize specialized care in these rural communities?
I don't know that you can really incentivize it, because their care is given by the number of patients they see, the RVUs that they're able to generate. That's just the reality of the business of medicine. And the reality of the geography of the situation is it takes time to get out there, it takes time to get back, and that's time they could be seeing patients. And so one potential solution that hasn't been fully developed is the telemedicine. and being able to do telemedicine at distance with a level of quality and patient acceptance is something that will be able to make those specialists available out in the frontier area.
And I think a big part of that is patient acceptance, right? Oftentimes in rural areas, and even in urban areas, it's difficult for people to maybe gain the trust of new technologies such as telemedicine or artificial intelligence, or whatever it might be. So what steps do you think are necessary, or what do you think will be how do you think it will be possible to overcome that trust barrier that many might have when utilizing new technologies such as telemedicine?
I think a big part of it is consistency in the broadband utilization and availability out in the frontier areas. If you have a consult going and you've got the family practice provider trying to work with somebody else on this, or even a specialist that's trying to work with a patient, if that connection breaks, they're done with you. They're done. They don't want to do it again. They're done. Yeah. And the whole problem is they want to be with the patient. They want that patient to have the best they can. And if they can't have that good experience, then that's not going to be something that happens. They'll say, well, they're just going to have to come and see me so I can take the kind of care I need to take. Or they'll say, maybe I have to go out there, but then they can't really afford to do that either because they're losing income. Like I said, the windshield time income going in and going out. I really applaud and want to honor those people who are willing to do that. Sometimes it helps them build their practice. Sometimes it helps them maintain their practice. For example, an interventional cardiologist that would travel out to a frontier area like that. While it does take some time, they can gather in some volume on the interventional side that is done back in their home hospital that they might not otherwise have. And that volume from those little hospitals tends to follow that pattern and go that direction when they can do that. And so a larger hospital that has a good outreach like that can actually help solidify the rural volume. If they don't support that small rural community and that small rural hospital dies, then that small rural community loses jobs and will eventually have difficulty and will depopulate. And in all likelihood, those people aren't going to be moving to the hub center that hospital went. They'll go somewhere else and get a job. Yeah. And so I think it works out really very well for them to support the small rural hospitals so that place can be well populated and as well populated as it can, being that it's small and frontier, and be a good citizen, so to speak, in the landscape.
Yeah. I think you just alluded to it, but I'm hoping you can just kind of talk about the business model of rural hospitals and how that might compare to other hospitals in Kansas or even around the nation. How is rural hospital, the economics of that, how is that different, or is it not different compared to their urban counterparts?
It's far more challenging. You'll see a urban hospital that there are some that close, there are some that are absorbed and bought and sold and everything else. All those things happen. Frontier hospitals or rural hospitals, though, is a far more challenging situation where you don't have the numbers to make the statistics work for you consistently. Right? Yeah. And so while you may have some good months and some bad months, you don't have enough good months to overcome the bad months. And so you have a very challenging thing where you're just kind of fighting for survival all the time. I've never been in a knife fight, but I'm thinking it's kind of a knife fight every day. Yeah. When you're in a small rural hospital. In a larger place, they can work on different things to kind of match their needs to the community a little bit better and with more predictability because of that larger critical mass of population that they have. The statistics work better for them. And so that probably is a central thing. And then when we talk about trying to get help, that larger community likely has a school. and so they can benefit from the school. Oh, gee, they have a training program and they train in our hospital. And the smaller hospitals out there, we will try and work with the school to do that, but we frankly don't have the volume to have that many students out there, and so that's kind of a challenge. And so workforce is just a huge thing. Yeah. And so the best thing for a small hospital, I think, is kind of a grow your own philosophy. So you start off doing something in the hospital and you're the kind of employee that they want to see grow, and so they help you along this, that, or the other, or mentor you maybe, and then you can advance and grow through that.
Yeah, awesome. So to kind of conclude here, do you have a call to action for this new upcoming generation to kind of empower them to join rural hospitals? Maybe like a little advertisement almost.
If I was going to say something, I would say, if you really want to help people, if you want to have a career where you're valued, if you want to be able to look back at some specific examples and say, that person is around and doing better because I was there, and if you want to be well compensated and be able to take care of your family, I think healthcare in a frontier setting or a rural setting is an excellent place to be.
Awesome. Well, thank you so much. We really appreciate your time, kind of discussing rural health, its strengths, where there's room for growth, and how it kind of compares to urban healthcare. So thank you so much for your time. It's really appreciated.
Thank you.
Awesome. I think that was good.